I'm the program coordinator of Westminster Foundation for Democracy. And we are currently series of WFD is a UK-based apolitical department working on governance issues, like working with parliamentarians, as well as civil society organizations. So we have been conducting a series of discussions on the topic of COVID-19 and the impacts, inequality, and solutions. So this is the third discussion in the series, and today we'll be talking about data, information, and the availability of data, information, and usage. Could you all please introduce yourselves? Thank you. Can you all hear me?
Yeah.
Yes, very well.
All right. Can you just, Nalaka, could you please introduce yourself, please?
Okay, hi, I'm Nalaka Gunawardana, science writer and media analyst.
Hi, I'm Nuwan Senaratna. I'm a computer scientist. I run a startup on and
Nuwan, your line is not very clear. Okay, all right, thanks. Now it's okay.
Okay, it's okay now. Okay, let me introduce myself. My name is Nuwan Senaratna. I'm a computer scientist. I run a startup focusing on AI and computer security.
Hello, my name is Royal. I'm a journalist. I'm an independent journalist, and I also work as the editor-in-chief at Raw Media.
Hi, I'm Deepanjali Abhevadana. I'm in charge of the media research wing at Verity Research, which is an independent think tank.
Thank you, everyone. So today the topic of the discussion is, like I mentioned earlier, we'll be talking on the COVID-19 impacts, inequalities, and solutions. And today we'll be focusing basically on the data information available for the general public, or the inavailability of data and information, and how that contributes or jeopardizes the entire fight against COVID-19 and protecting or defending inequality. The first round, we'll be talking about the gaps identified in this particular area. And in the round two, we will be discussing what could be the potential solutions for these gaps or the issues identified. We would like to start the discussion with Nalaka's remarks.
Okay, thanks. So if I understood the theme for our conversation today correctly, we're talking about data availability and non-availability, or how much data is available and how is it being used or misused or not used. That's what I understood as the broad scope for our discussion. So I thought I'll offer a few initial thoughts to get our discussion going, and also to get us to think. It's a crisis situation, and it's a prolonged crisis. It keeps unfolding, and we don't as yet know where this is going to end, in what manner. Nobody in the world, I think, right now knows how this is going to pan out, although there are projections. So information management at a time like this is particularly challenging, because nobody knows all the information or even the various possibilities. In this, the good news is that where the disease data is concerned, the Ministry of Health in this country, in Sri Lanka, has a well-established practice of data gathering regularly, data analysis, and also data publication. They've been doing this at crisis times and pandemic times, as well as on an annual basis, a very comprehensive compilation of health sector data is being published. So that system has geared into action in response to this particular COVID-19 crisis. The Health Ministry's Epidemiology Unit, as well as the Health Promotion Bureau, they've been publishing epidemiological data every day. From around mid-March, they've been doing that every day. And of course, there are critiques of that data. But I think for the duration this emergency lasts, we need some sort of an official data framework. Therefore, what I personally have resolved to do is we will accept this data as the official counting and official analysis. We can critique it later. Once the emergency somewhat fades away, we should critique it for the quality of data and whether there are data gaps and so on. But for the moment, we have some sort of a framework. That's point number one. Then, besides the health data, there is also the information flow on the responses coming from the President's Office, the Department of Information, the military, the police, as well as the various task forces that have been set up with thematic mandates. Now, where that kind of data is concerned, there are issues. We know that, for example, the media releases about the curfew or the lockdown is often ambiguous, and it has led to a lot of social media comment. And even if you allow that, even if we leave that aside, there are other issues. For example, compliance with the national language policy is poor. The time-sensitive, significant communications from government do not come often enough in Tamil language, and this has implications. If 20 to 25% of the population does not understand what the government wants them to do, simply because it doesn't come out in Tamil language at the same time it does in Sinhala, then how are we going to ensure disease control as intended? So there's a problem there. Then, of course, we have to say that the Ministry of Health, especially the Health Promotion Bureau, tries very hard to put out everything in Sinhala and Tamil at the same time, to be appreciated. And let's hope the other arms of government will also emulate them. Data consistency among official sources has also sometimes been lacking. For example, the Epidemiology Unit and the Health Promotion Bureau statistics sometimes have discrepancies. But again, these may be due to lack of coordination rather than any other deeper reason. Now, one thing that concerns me is as this pandemic progresses week after week, we are not getting granular enough information or data so that we can understand the trends and analyze it. Not just researchers, but also journalists and others. Now, take for example, today is the 5th of May. By 9 a.m. today, according to data, there have been 27,828 COVID-19 tests. But what does this 27,800 mean? What are the demographics? What geographical spread? Have some people been tested more than once? We don't have those insights from the cumulative figure of 27,800. I think we now need that. Just adding up numbers and giving us the tally may have been okay at the beginning, but certainly not anymore. So the quality of data, the level of detail, these things we need to improve. How the data is used and misused. Let me very quickly share some observations of mine. As a nation, we are not very data literate, and that includes professionals, includes journalists. We go by impression rather than by evidence, and that I see even in looking at the available health sector data, available information. we do not often understand it enough. I won't go into the academic uses of data. I'll leave it to the others on the panel. But media use of it is very limited. This is despite IT industry colleagues, some of them offering us data visualization, data projections, using available official data. For example, something that I go regularly to is the Coronavirus Sri Lanka Analytics Dashboard, which is at covid.iq.lk. And they help us understand the raw numbers better by visualizing. They offer a number of projections. For example, when I looked at it this morning, they say that we expect the spreading will continue until 31st of July this year. Now, it's of course only a projection, but some playing with data is being done by data savvy IT industry people. Unfortunately, most of our media doesn't pick up on this. They just keep reporting the raw numbers, and the criticism I've seen, somebody in Twitter said, this is like, updating the score in a cricket match. Do enough journalists realize we're talking about human lives, human livelihoods and families, and therefore bring more insights, bring human dimension into this data? Not enough of that is happening. And also, for example, discussions like, at which stage of this pandemic are we in Sri Lanka? Now, WHO has defined different stages. Now, from what I understand, we are still in stage 3B, when the patients are found from small clusters or village level clusters. Now, is there a risk of progressing to stage 4, which is community spreading, where the patients cannot be traced to another patient easily? So these are discussions and debates based on data, and it's an analysis that we should be having. But unfortunately, I don't find enough of that in the media. But I know that raw media, for example, has urged us to look at the number of active cases rather than the cumulative numbers, which is a very good approach that I wish other media would also take. But overall, there is a certain amount of data. Wish we had more detail and perhaps more comprehensive data, but we're not even making use of what we have in terms of understanding it and in terms of using it for policy as well as for public response. So these are my initial remarks. When we come back, maybe I'll touch on this whole phenomenon of disinformation. That is also a huge concern. Hello?
Hi, Nalaka. Can you hear me?
Yes, now we can hear you. I think you are muted your mic.
The line is a bit, anyway. Thanks, Nalaka. Thank you for the one. Look, Nuwan, could you just please share your thoughts with us? Nuwan, can you hear us?
Yeah, I can hear you all. Can you all hear me?
Yes.
If sorry.
Please turn on your video.
Yeah. Sorry, I missed what Nalaka said. I'm not sure whether anyone spoke after him as well. So a couple of things. So my interest in this from the data side, and when we talk about kind of data privacy, it depends on exactly what set of data that you're talking about. So kind of let me just focus in on the subset of data that under the COVID situation and look at data, you can you need to ask the question, okay, what do you want to do with this data? And so the way I look at it is what costs are we trying to reduce using data? And so if you look at COVID, there are kind of many different costs. The most important two types of costs are what's the cost created by the disease in terms of kind of deaths and illness and things like that. And then at the other end of the spectrum, you got kind of costs of the cure through kind of lockdowns and curfews and kind of economic impact and things like that. So I'm mostly interested in, okay, what is the data that you can use to kind of answer questions on these costs, and how might you reduce costs based on that? So for example, if you look at the of the disease end of the spectrum, who is going to get infected next? Or can you predict the number of ICU beds or ventilators? Or can you predict, okay, what parts of the country are kind of most at risk, and kind of who should be quarantined, or who should be what parts of the country should be restricted, and so on. And so if you, and the better the answer to that question, at the other end of the spectrum, you can kind of minimize the sort of the economic costs. So I'm kind of mostly interested in that, and just kind of a caveat, while this is kind of related to my day job, I'm mostly participating in this on a kind of a voluntary basis, and kind of sometimes on an advisory basis. There are kind of people on the inside who are kind of doing this as part of their day job. So I think that's my kind of scope in terms of data. I think the other sort of related point is privacy, and I think this is related to my day job, in that how do you kind of get the best out of data while still kind of protecting privacy? And so there are some kind of interesting areas where you can try and kind of minimize the sort of the leakage of private information, but still try and kind of maximize the value that you're going to getting out of the data. So yeah, so that's where I'm coming from, and sort of these are my thoughts on this problem. Yeah, can you all hear me?
Yes, can hear.
Yeah, so back to you, Ankaran.
Thanks, Noah. Thank you for that. I'm something wrong with my connection, and I'm sorry about that. Royal, could you just please share your insights with us?
Sure. So I am speaking from the point of view of a journalist, and I, like Nalaka said, I found that the data given by the Health Promotion Bureau and the epidemiology. Okay, I get very nervous. I'm sorry. I hope you can edit this part out. I want to start again. Okay, so like Nalaka said, I think that the information given by the Health Promotion Bureau and the epidemiology unit offers a good framework for the data we need to report. And like Nalaka also said, I made a personal decision early on, and it's not a blind decision. It was a sort of an assessment I made that the data that was being given by these two websites were accurate. I was not going to question it at this point because there was no real reason to question it. Unlike the end of the war, when there was a blanket sort of a ban on media or a ban on information or restriction on information, I didn't feel that this was happening at this point. Also, very early on in the whole COVID situation, Mr. Rajapaksa, the president, made it clear that he wanted people to have access to internet and access to information. So these little things made me feel that there wasn't really any kind of plot or any kind of conspiracy to keep information away from the public. So that was, I think that went a long way in establishing trust. Even the setting up of the National Center for Prevention of COVID-19 outbreak, and that's been this is like, the previous government had a little committee that was the new government's way of dealing with this sort of thing. And again, my response to that would be it didn't matter, because it seemed like the government was moving in very quickly to deal with the situation. Like Nalaka also said, my takeaway from COVID-19 initially was disease doesn't come with a handbook. Nobody tells you how to deal with it. Not journalists, we ourselves didn't know how to deal with it. The situation was evolving very, very fast in the initial stages. It's only now that it's sort of settled. So in all, I felt that the government response was very good at the start. And this is not to say that they are without criticism, or that they have had areas in which they are not weak. But in general, I feel that they've stepped up to the plate and done a good job. So from the Health Promotion Bureau side and the epidemiology side, we have had, I think, very clear data from them. There is some lag between the two sides. I was impressed that the Health Promotion Bureau reached out to Arimac, or Arimac reached out to Health Promotion Bureau, and that private-public partnership was set up. So it was not like they were trying to keep it within the government also. This other company set up a website very quickly. I think within the first week of after the first case was reported, within the first week, the website was set up. And Arimac themselves were very approachable. I spoke to them, and over Twitter, it wasn't even like a personal exchange. When I found that some of the data was represented in ways that I didn't understand, they were very quick to change the information in a way that was clear. To date, they're very open with changing any of this information. And in general, I find that in a general sense, in offering a framework and in offering basic data, we're doing quite well. Aside from that, certain areas and issues that Nalaka also raised, I do have concerns with, and some of them maybe not as much, because I'm again looking at it from the point of view of journalists. In terms of privacy, again, I think, so getting back to the National Operations Center for Prevention of COVID-19, so what the Health Promotion Bureau does and the Epidemiology does is very different to what this entity does. And this entity, a lot of the time, all it does is, well, I can't say all it does, but what it does is it holds press conferences that are pre-recorded, and those messages are disseminated to the media. So one issue with that, and this is again, there is no real solution to it. With the current situation, there's no platform really for journalists to ask questions, because press conferences are no longer being held. So the information is centralized, the dissemination of information from the government is centralized. It has its pros, it has its cons. The pros are the media itself is not, you can't say that everybody in the media has the most, the best intentions. So when the information is centralized, it's very easy for me watching to see who is using that information in ways that perhaps are not the best, in the best interest of the public, which is what our job is. But on the other hand, because there's centralized information, we can't really ask the questions we want to ask. And some of the questions we have wanted to ask, especially from Go, which we've been trying to figure out, is how many deaths during this period that are not assigned to COVID. So we ourselves can ascertain if, for instance, people died as a result of lack of medical care, or lack of just because the entire health system is focused towards COVID. There were other areas like that. Other questions that we've noticed that have come up have been things like maybe COVID came into the country a lot earlier before it was officially detected, because there was a very bad flu going around just before then. So these are questions that have come up and cropped up, but not questions that we can find solutions to or answers to right now. I think this is a long-term project where once everything is over, when the data finally comes out in a more concrete and open manner, we have access to it. Even with the PCR testing, that sort of data only began to come out recently. Like Nalaka said, it's not very comprehensive. It's just a very basic block of data. It's this day we did this many tests. But if you think about it, any of the information that comes from the NOC PCO is kind of like that. The information that they give us as the media, they never break it down. It's always, here's the cumulative count, and that is particularly why the media tends to report just the cumulative count, because it's easier for them. And I don't think that's the right thing to do, and that's something I've had a discussion with Nalaka about earlier also, and something Ro and myself on my own Twitter we work really hard to change, is that we try to report just the active cases, because that is the accurate data. I feel people should not be worrying about this cumulative count, which is not real, because the cumulative count includes people who have recovered and left and people who have died. So it doesn't really fall into this count. And also the media's habit of saying things like, oh, numbers have soared, Sri Lanka's Sri Lanka's COVID-19 cases on the increase. That sort of thing. I think media needs to be this is something everybody knows, but media needs to be more, a little more careful about how you do things. Also, I think from the government side of side of things, and this is a good thing, they have not released any of the names of the people who have passed away as a result of this. Certainly not from my knowledge or understanding. While the media has scrambled to try and find out who, what, when, where, and try and divulge those details. So I think, like I said, this is a brand new situation, not something any of us. I mean, I'm still a rather young journalist, but even more senior journalists have not dealt with this sort of thing before, and I think it's a mix of getting some things right and getting some things wrong, and trying to just figure out the best way to move forward. I think my conclusion from this would be that in terms of data, we're doing quickly, but the PME and the NOC, PCO really need to work in terms of coordination of information, especially a lot of the Tamil information or the Tamil press releases do come to us, but it took 20 minutes to half an hour. And that's 1 hour late. It's almost no use putting it out at that point, even though I do try. So these are areas that they really need to work on, and it'll be nice to see them do it in the future.
Thank you so much, Rahul, for that, for those the Panchali, can you just
Sure.
listen to your analysis?
Yeah, thank you very much for having me in the panel. I have actually, you can see me, I guess.
But yeah.
You can see me, right? Yeah. I have 3 very quick points that I would like to draw your attention on. One is ethics. We have been focusing on the print media and also to some extent on electronic media to understand what kind of media reporting that we have seen with regard to COVID-19. But the overall reporting that we have seen both on electronic media and print media is actually quite disturbing, because it was unethical reporting that we saw largely. For example, we saw racial profiling where certain groups, certain individuals belonging to certain religions and ethnicities were unnecessarily highlighted in reporting, both in print media and electronic media. Now, this was the case despite ethics being there, even in our Editors Guild in Sri Lanka, which clearly say that you should not mention ethnicity or religion if it is not directly relevant to the news. But the Ministry of Health and Government Information Department had to issue guidelines again, outlining some of these because of the unethical reporting that we were seeing. And apart from racial profiling, where only some of the ethnicities and religions were necessarily highlighted, we also saw prejudices being highlighted, even after the guidelines were issued by the Ministry of Health and Government Information Department. So these prejudices were put forward in a way that they're very subtle, and it's very difficult to say that, okay, this is an ethical violation. For example, there was this one particular single reporting where it said that some of these patients belonging to a certain religion, or some of these COVID patients belong to a certain religion that has more population density. So it was the prejudices which were put forward without explicitly mentioning the ethnicity and religion, which was like a loophole in the guidelines. I don't think it's a loophole in the guidelines, but in a way that there was some of the media were able to find a loophole in order to do what they have been doing. Apart from racial profiling, another disturbing trend that we also saw was how the privacy of COVID patients was intruded. there was a media spectacle that we could see on certain electronic media channels, where the houses and all the private details of the patients were put out there without considering their privacy to any extent, and that was quite disturbing. And we, on ethics side, we've raised these questions a couple of times. And apart from this, also we saw a lot of stigmatization and discrimination being leveled against COVID patients. For example, there was now we have seen in print media how most of the time suspects who are not proven innocent, guilty before courts are criminalized. Similarly, we saw how COVID patients were criminalized, or they were seen as being responsible for the overall spread of COVID-19. And we also saw how some of the segments, including those who came from Italy and South Korea, were also blamed, in addition to the public being overall blamed for the spread of COVID-19. So the question we have to ask here is this ethical reporting, and to what extent media has been conducting civility in the way it has been reporting? So the disease that we are combating is not just COVID, but also issues like racial profiling that have to be immediately addressed, whether it is COVID or not. And then I'm going to my second point, which is somewhat interlinked with the first point that I spoke of, which is ethics. The second point I'd like to bring your attention is on facts. So it is quite important to focus on facts, regardless of it being an epidemic or a pandemic or not. But so Nalaka can speak a lot about misinformation and disinformation. He was doing a lot in terms of educating the public on these fronts. If we look at now, there was a lot of misinformation and disinformation being circulated with regard to COVID-19, not just in Sri Lanka but worldwide. But we can identify a certain category that was quite key when it came to misinformation and disinformation. That was with regard to the remedies for combating COVID-19. So some of the print media in Sri Lanka were quick to say that, even going to the extent of quoting certain medical practitioners to say that drinking kottamalli is the solution for COVID-19. And some of the remedies that have not been proven to be remedies were circulated as ones that the public should be following in order to not catch COVID-19. So this was a disturbing category of misinformation and disinformation that we saw in the print media. And one of the main problems that I'd like to highlight with regard to facts is the lack of verifiability, or rather the media, the majority of the media did not take enough measures to check most of this information with other reliable sources, which are also present worldwide. And some of the conspiracy theories that we saw that had been debunked elsewhere were again circulated repeatedly in some of the print media in Sri Lanka. And therefore, the need to verify information, the need to check information before publishing, and also the need to rely on reliable sources, and also to refer to multiple sources before publishing something. These were some of the areas that went unnoticed, or that were not given priority to in reporting with regard to COVID-19. And this we saw as quite disturbing in a large section of the print media, and also to some extent on certain electronic media channels. And then I'm coming to my third point. Before coming to the third point, I also want to emphasize on one other factor that sits between both ethics and facts. That was the reporting that was done in a way that was creating fear-mongering or scaremongering. So one of the main media ethics is that you should not do reporting in a way that will evoke fear and shock among the people. And what we saw as the understanding among some was that people have to be frightened in order to make them comply to the guidelines that have been issued by the government in order not to catch COVID-19. But then to what extent, I'm coupling that to the initial concern that I had with regard to civility, with regard to ethics. How ethical is it then to actually drive a public which is living in fear and panic in order to in order to prevent the spread of COVID-19. And I think some of these unethical media reporting and disinformation and misinformation were actually driving a narrative that was not at all conducive for combating COVID-19, because we had a panicked, frightened public which did not want to come to the authorities in order to be maybe tested or to be hospitalized because of the fear that has been created. So that was a main concern. And then I'm coming to my last point, which I want to quickly highlight. That is with regard to the focal point. So apart from facts and ethics, the other point which is focal point is with regard to the focus the media has on COVID-19. Is it what is the narrative that the media should be driving now? It's again connected to the fear-mongering narrative that I've been focusing on. Is it like Nalaka pointed out at the very beginning, it seems that the humanity or this human element of this is completely missed out. We have media, not just in Sri Lanka, it's mainly even like worldwide, where we see the focus being placed on stock markets, but not so much on the vulnerable or the downtrodden or the weak who are actually struggling to come out of COVID-19. And we may be focusing on economy, which is necessary, but are we also focusing adequate attention on those people who are losing jobs as a result of COVID-19? So what is this focus? We are focusing every day on the number of people who have been infected, the number of people who are dying. And well, it is definitely important, but is it the only focal point that the media has to be focusing on? Are there other narratives that are missed out from this, which need attention more than this? And while focusing on those aspects, I also want to speak a little bit of the curfew that Nalaka also mentioned at the beginning. Is there a rationality, is there a rationale in the way curfew is being imposed? Are these being adequately questioned in media? And are media in a situation where they only report what is coming their way without actually getting the opportunity to fact check or to go into multiple sources? But we also have to bear in mind some of the concerns that Royal also pointed out, which are practical concerns that journalists have in terms of accessing information. Having said that, we can also focus on the reliable, acceptable, verified information available in the international arena that can be used by journalists when focusing on certain issues. I will take other points maybe during the rest of our discussion.
Thank you. Thank you. I'm extremely sorry about that. Thanks, Deepanjali, for that. So, like before we go to round two, I just want to briefly recap what has been discussed so far. So initially, there are three major points. One is detailed information on certain issues, certain areas are not available, and then again, no one also highlighted about the cost related to data in addressing COVID-related issues. And then the other issue that came up in the discussion is the privacy and how media is reporting COVID-related incidents and how the authorities are trying to safeguard the interests of public when it comes to media reporting. And then again, in general, the ethics, media ethics in general was discussed, and how media is, the limitations the media organizations have, and the availability of information, the chances to verify the information, or the media basically reporting what is available. They are not asking, they are not in the position to ask any questions, because most of the information available in the public domain is pre-recorded, and there is no room for the journalists to question the authorities or the arms that are fighting the COVID-19 in Sri Lanka. So we so far we have had so many issues in different areas, like we just discussed. And in round two, we would like to hear from our discussants how how these, at least some of these issues can be dealt with in coming days, or what can be done, or what is the lesson for Sri Lanka in fighting COVID-19 as well as any other issues, like relevant issues in the future. We will go in the same order. Nalaka, could you please just can you hear me, Nalaka?
Yes, I can.
Thanks, Nalaka. So I would say, so in round 2, I would just ask, like, I would like to ask you what can be done about the issues raised in this discussion. Thanks.
Okay, it's a big question to answer in a couple of minutes, but I don't know whether we can fix any of these problems in the days or weeks in the short term. But in the medium to long term, I see 2 or 3 needs. One is we need to improve the quality of data that comes from our public institutions, especially technical institutions like the health ministry and its agencies. Then the need for data to be interpreted, data brokers, journalists being one, but we also need civil society, we need public intellectuals, we need those who want to take official data and then, I don't like this term interrogation, but basically try to make sense of official data. Look at trends, look at gaps, and ask the critical questions, and then post these critical questions in the public domain to seek answers from the government, but also from the experts. Now, the medical professionals have also been divided in this current emergency. Now, this is something interesting I've been following. So we have one set led by the GMOA, Government Medical Officers Association, advocating a certain response, which they say is based on their medical professional analysis. But not everyone in the medical profession is agreed on it. And they have very different interpretations on how long the restrictions should last. Initially, there was very little emphasis on PCR testing. Some, of course, to the GMO's credit, they have been advocating it from very early on, and now it is happening belatedly. But there have been others on other topics where there hasn't been enough consensus. Now, those discussions and debates need to happen ideally in public platforms, in professional circles, in the media, and so those, I felt, in March and well into April didn't happen enough. And partly the media has not been providing a platform for these discussions. So as my other fellow panelists said, media being passively merely carrying he said, she said, and the various raw data, we didn't go beyond, the media didn't go beyond to facilitate that discussion and debate. So we need, for the remainder of this emergency, we need more discussion and debate. Not to the point where action is paralyzed. Of course, the government has a responsibility to take actions and can't always wait for consensus. But evidence-based policies and decisions need to be advocated by everyone who's interested in structured response to this crisis. And by the way, this crisis is not going to end simply when the virus stops spreading. For months and years to come, there will be the economic and social impacts of what is unfolding now. And that requires a very thoughtful, evidence-based, human rights-driven response. And so for those things, I would like to see enough discussion and debate, and the involvement of public intellectuals, a deeper and more meaningful media coverage of the remaining challenges, all that. And then on disinformation, we didn't get to talk too much about it, but this has been one big obstacle in our current COVID response. It's as if, I was looking for a metaphor, it's as if, you know, in many urban, semi-urban areas, we have water supply. Basically, we turn a tap on and we get our water. That water has been chlorinated. It has been purified to a certain extent. It's not fit to drink in this country, but we use it. We boil and use it for drinking, and we use that water. It's as if our water supply is bringing sewage. The water is contaminated with sewage. Imagine such a scenario. Now, media, mainstream media and digital media has been bringing us a mix of the right information, the proper information, as well as a lot of dis and misinformation. So it's all mixed up and contaminated the information landscape. It's affecting everyone, the way they think, the way they perceive and react to this emergency. We need to address this. And this is why WHO has called it infodemic. UNESCO goes one step further and now calls it disinfodemic. Parallel to the pandemic of the virus, we absolutely have to address, in short, long, both short and long terms, the infodemic. Because, and for that, we need digital literacy and media literacy to be built. Thank you.
Thank you so much, Nalaka. I have a question about the human rights driven approach and how this lack of information or the information available is affecting the rights of the people in general, as well as the certain vulnerable communities. We will come back to that later after we listen to all the speakers. Nuwan, yeah, can we hear more about the cost-related discussion on this issue?
Yeah. So so I think most of the thoughts that we heard today were around kind of disseminating data from the inside to kind of the general public, kind of a more journalism-focused view. The point of view I was bringing was more on that of a kind of a data scientist, and more on the inside, where you use available data to make various decisions related to the epidemic more intelligently. And so what the point I raised about cost was more about trying to figure out, okay, what are the most important questions and most important problems you want to solve using the data, and that's where I brought up cost. You want to reduce cost. You want to reduce cost in terms of kind of saving people's lives. You want to reduce economic costs. You want to reduce the cost of lockdown. That's what I meant by cost there. So I'd like to kind of raise kind of 3 points around kind of challenges and things that we should do better. I think the first point is, and this is both observable locally in Sri Lanka and kind of globally across the world, which is around using data to kind of make decisions. There are a lot of kind of sketchy efforts all over the place which need to be kind of collected, and a lot more people need to collaborate. So I'm hearing efforts from kind of reputable universities globally, which are not getting the platform to kind of help out in this effort. So I think that's the first point. There's probably a lot of kind of intelligence and work out there which hasn't got used to solving the problems as yet, and that's sort of acceptable given that this is a new situation, new scenario. It's not something that we are used to. It's not something that we do every day. So that's my first point, kind of trying to figure out ways in which we can collect these efforts. The other is, in many ways, 2019, we were discussing kind of how we can kind of tighten kind of data protection and the use of personal data. But in 2020, it seems to have somewhat gone the other way, in that we can use data, or how do we use data to kind of fight COVID at the expense of privacy and so on. And I think that's an interesting how that conversation evolves and how kind of data protection laws and so on. So I think we need to make sure that it doesn't go to either extreme. And my final point is this looks like something that might happen more and more often in the future, and it's sort of in a way you could ask, I mean, many people have asked this question, kind of why haven't we kind of prepared for this earlier? And I would kind of ask the same question from a data science point of view. We knew this was coming, and so how can we prepare better for kind of the COVIDs that are going to come down the road as well, once this gets kind of sorted out. So those are my thoughts.
Thanks, Noah. Just yeah. So yes. So this interesting point about how we are to give up on the rights on the privacy, in particular, to fight COVID-19 and the consequences of that particular step we are taking and the future consequences, okay, what we have to face and how that can be manipulated and that kind of stuff is an interesting debate, and we will talk about it, talk more about it later. Thanks, Noah. Thank you so much. And can I, Royal, any final remarks? Royal?
I'm sorry. I was on mute. Sorry. So in conclusion, I think I'll just touch on what Deepanjali brought up and also what Nalaka brought up about a more human rights approach to, or human-centric approach to journalism. And because that's our role as journalists, as a media organization, and I speak from the point of view of RO here at this point. So this is again something that Nalaka and I have talked about earlier. RO decided very early in this situation that we would take a three-pronged approach. One was, of course, replicating the data that came from the government. The second was that we were going to focus very strongly on human stories. So given the challenges that we had at that point, which was that many journalists couldn't step out of the house, many journalists to date can't really go out and find the stories that they wanted, we had to work around that. And in a sense, I think the fact that we're a digital platform helped because we just leveraged our contacts. We just moved from contacts to contacts to contacts and a network of contacts. We used technology like people who had smartphones to take pictures of people that they knew who had a story to tell us. So to sort of crowdsource stories that we're still working on. Many of the stories that we published to date are crowdsourced. We manage it. We initiate the process, but we get the stories because for us it's very important to represent what people are saying or people's situations, whether it's factory workers stuck in the free trade zones, whether it's the people on the street who, their work is essential service, so they have to stay here. But strangely, their reaction to it is that they're very happy to be working because that salary or whatever payment they get goes back home. So different stories, and especially even things like Ramadan. Ramadan is going on at the moment. How the Muslim community has replicated that sense of community online. These are different stories that we've tried to focus on during this time, and I think that will go on into the future because, like Nuan said, which is very disturbing, there is going to be until there's a proper solution to COVID-19. It's possible that this will keep recurring. So future COVIDs and stuff like that. It's good that we have a framework on how to report at a time at which we are in lockdown. So that's from the RO point of view, and I'm not trying to say that RO is in any way the golden standard. We're learning a lot on the ground. We're a very young team, but this is how we've chosen to represent as far as possible the stories in addition to representing what the government has said. But in terms of data, I have to say that in Sri Lanka, in general, among journalists, there's not much education or experience when it comes to representing or interpreting data. Data journalism is not something that is very well known. It's among a few within the journalism circuit or circle know about it, but most of us are still experimenting. We're not really sure about what tools to use, what not to use. It is still data journalism, or data itself still resides very much in the hands of tech enthusiasts or people like Nuan, computer scientists and stuff like that. It's only, I mean, in other countries, this is something that is used. Data journalism is a thing, but here in Sri Lanka, we're learning a lot of it. So that's something I would like to see. There are two areas here that I feel that it's not just journalists, but also the government. Another thing that I notice is there's almost no government, like there's no data to be got aside from the Health Promotion Bureau and aside from the epidemiology unit at this moment. Most government entities do not understand data, do not have data. We have nothing to work with. Even as journalists experimenting, we don't really have data that we can pull from certain websites to use in our experiments or how we try to learn how to project and interpret this data. So if I could say something about moving forward, I'd say data literacy, in addition to, of course, media literacy, which is separate and equally important or even more important problem, but data literacy, where government sector is taught and is encouraged to publish their data and make it available publicly. Similarly, journalists, as a matter of course, everybody should know how to use the data. It's very easy, actually. I'm not saying that journalists should make predictions necessarily. It's very easy to use the existing data and just make it. The whole point in using data is to make it easily accessible to the public. So there's no use in taking data and making it more complicated. Accessible way for people to understand what's going on. So those are the
Right. Thanks, Royal. That's something wrong with the connection anyway. Okay. Thanks, Royal. And Deepanjali, like we will just listen to your remarks before we just conclude the discussion.
Sure. I don't think there is a specific question directed at me, so I will go with the question that you initially asked as to what can be done in order to stop all these issues that we've discussed before. What I can emphasize on immediately is of an ethical approach for media, because what we are focusing on now is of media reporting, which is quite important because media is playing the role that of a fourth estate, which is quite key for a democracy. It is in the hands of media in order to disseminate accurate, verifiable information, to inform the public of what is happening, and also not to engage in any kind of fear-mongering reporting that will actually have the results that are not expected to be happening. So while focusing on the larger role that media has in a society, whether it is pandemic or not, I think it is quite crucial for the media to engage in ethical reporting. And it is a part of this ethical reporting that we can speak also of factual reporting. So facts and ethics go hand in hand. And if the journalists of both the print media and electronic media, I'm focusing on these two because they are still largely consumed in Sri Lanka, but it also goes out to anybody who is also functioning as a digital journalist. If you're disseminating information to the public, it is in your hands to be ethical and to make sure that your reporting is not actually maximizing damage, but actually minimizing damage, and that there are any parties that are discriminated against or that are subject to stigma, which will actually result in quite a large number of negative effects on the society, resulting in a detrimental impact on the society. So these are the immediate things that I can focus on. And if we also look at the way how sometimes the print media and electronic media have been reporting on COVID-19 overall, we can see a critical discourse being put forward by newspapers, which we can categorize as the alternative press, whereas the larger section of the mainstream media has been actually quite unanimous with the messaging of the government. So So this is also a problem that I did not highlight earlier, but I would like to highlight still under the ethical component, because rather than being a kind of voice of a certain messaging, it's quite important to ensure that the public are critically engaged and that critical discourse is actually disseminated to the public. So these are some of the key highlights that I can emphasize on. And I'd like to end my point, unless you have any questions, to say that if ethical reporting had been done, there would not have been a necessity for some of the ethical guidelines that were issued by the Ministry of Health and Government Information Department. And also, it's not just during this period that we see problematic reporting. We've seen it always. What is problematic is that some of this unethical reporting gets intensified or amplified during situations like this. And this is why we have terms like infomedic, which show that it is actually a worldwide phenomenon that we have to immediately address. So if you focus on Sri Lanka and focus on the need to combat COVID-19, I think the larger responsibility now lies with media, without actually contributing to a media spectacle, but to engage in responsible and ethical media reporting.
Thanks, Deepanjali. I just want to ask. I mean, it's just a panel, no specific speaker. I mean, I'm just throwing this question. So so now the discussion is basically about using the data to fight COVID-19, as well as how to fight the misinformation or disinformation on the media, basically print as well as electronic media. So that using the data to fight COVID, one is to eradicate COVID-19. That is number one. Number two is basically to make sure that people get what they need, actually, at least the essentials. Whether that has been achieved, whether the data, the government is using the data, not about the COVID patients or the cases. I'm talking about the general population and how the data is being used to address those needs, the people's needs, for instance, essential items, hospital facilities, pharmacies, and that kind of stuff. Whether there is any steps taken by the government to use the existing database they have to address those issues. Or anyone would like to respond to that? I mean, if it's a question, how that has affected the vulnerable communities in general, the lack of information or not using the information, or you're using the information in addressing those issues, the general public, particularly the marginalized communities.
Well, your question is a good one, but none of us being from the state sector, we simply don't know. We can only look at the outcomes, not the inner processes. Now, in one of the recent discussions with his chief advisor, President Gotabaya Rajapaksa did say that every day he gets a lot of data updated and given to him. Not just health data, but administrative and financial data, I believe. So presumably, it seems that there is a certain flow of data coming to the decision makers at high levels in government. Now, of course, we don't know exact processes of making decisions. The policy making and decision making mechanisms in our governments, all our governments, for the past many decades, these have been somewhat opaque and difficult to comprehend from outside. But presumably there is evidence-based decision making. But just data alone, cold data, I think is not enough. We need the human rights perspective. We need the human considerations. That is why technocratic discussions need to bring in, for example, social science perspectives. They need discussion and debate. Once again, I'm saying we are not discussing enough of the options and the costs of different responses. So the social costs, short to long-term costs, the economic costs, there are expert predictions, but we are not discussing them enough. So this is what we need more of.
Speaking of this human rights based approach, like then again we hear it's about like life versus liberties. Like people are talking about curfew and how it's implemented, how people have been arrested and kept, and like that kind of debate is going on. So drawing a line between these two it's quite difficult at times like this. So and then this is why it is important that people are informed of all the decisions taken by the authorities, the respective bodies. But it seems that gap is still there, and people are like because of the notifications or the processes we get, which is not very clear, and people are like confused, running here and there, and to try to find the essential items, the pharmacy, the medical items, etc. So that, speaking of all these issues, like when we talk about like the using personal data to fight or to address those issues, how the cost of privacy, how that can be resolved, like what are the options we have in addressing those issues without jeopardizing that particular aspect.
I think that's a topic for a whole 1 hour discussion, and I think we need to bring in the legal minds to this and the human rights specialists. But to answer it very quickly, I think during the civil war as well as last year, we citizens were being asked to choose between privacy and security. Okay, we had to concede some of our rights, including privacy, so as to be protected. Now again, we are being asked for public health. We should concede some of our right to privacy, some of our other rights, so that we are protected from the invisible virus and the pandemic. Now, clearly, there are trade-offs. But what are the trade-offs? What are the acceptable trade-offs? And who decides on those trade-offs? And on what basis, what discussion? That's what's not clear. And this is where, what are the safeguards that we put in? These are things we need to have robust, wide-ranging discussion. A bunch of technocrats, medical or administrative, cannot sit in one place and decide for 22 million people. That's the bottom line.
Thank you so much, Nalaka. Thank you so much. Anyone else has anything to add? Any final remarks, final comments? All right. If there isn't anything, I would like to thank you all for agreeing to to participate in this discussion and providing valuable inputs as to how the data information can be used or misused in fighting COVID-19 in Sri Lanka and addressing the issues linked to COVID-19. Thank you so much, everyone, for your valuable time and input. Thank you so much.
Thank you.
Thanks so much.
Take care, everyone. Bye.
Thank you, everyone. Thank you, Ankaran. Bye.
Thanks. Thank you very much.